we may be here for different reasons, I hope we can all unite around trying to save the A&E and maternity.
Hello, I'm Debby Monkhouse and I'm standing for Labour for the Town Council and the Unitary Council for Swanage. I'm going to mainly focus on the work that I've done to try and save Poole A&E and maternity, because that's been a big part of my life over the last 3 years. I got involved when I first heard that the Clinical Commissioning Group, they're the people who fund our services, were going to close one A&E and maternity, either Poole or Bournemouth, and that they were intending to close Poole. I had a respiratory arrest in my 20s and I just couldn't believe that they were considering closing Poole. For us here in Swanage, as I know myself, time is of the essence in many medical emergencies, and the idea that we're going to have to go beyond Poole is pretty much as far as you would ever want to go in a crisis now. And we're talking about moving it significantly further away, another 20 minutes to get to Bournemouth, or another 10 minutes to get to Dorset County. The problem with Dorset County as well is that some of the services that we can access at Poole that are so important. So a mum who gives birth and their newborn needs intensive or high dependency care, that's not available at Dorset County. That will only be available at Bournemouth under the changes at the minute we can get that at Poole. Or any mum who's giving birth under 32 weeks, the same thing, they can only go to Poole now and they'll only be able to go to Bournemouth under the changes. So for us here in Swanage, we're looking at risk to life in maternity emergency, we're looking at risk to life in a range of medical emergencies, stroke, heart attack, sepsis, respiratory arrest, meningitis, and we're looking at risk to life in trauma. So if someone has a road traffic accident or something like that, we've got such a long way to go, and I just couldn't believe it. And one of the first things I did was I wrote to Richard Drax to ask him, what are you going to do? I said, how are you going to lead the campaign to save Poole A&E and maternity? I've never had a reply to that email 2.5 years later. So I realised, if any, I'm going to have to stand up and start to do things. So I really have stood up. We've taken the Clinical Commissioning Group to the High Court, which was a process where we had to fundraise. Someone stepped forward very bravely to be a claimant for that case, which was quite a stressful thing for them. They've got serious health problems as well. And although we weren't successful, the case was last summer, we're seeking leave to appeal. So at each point, if we haven't succeeded, we've gone on to the next one. The other avenue we've pursued is we've tried to get the local authorities to refer this matter back to the Secretary of State. So through the local authority system, the town councils, the district council, and feeding up to the county council Health Scrutiny Committee can decide if plans don't work for the residents in their area to send them back to the Secretary of State. Now, this is not a complicated decision. Whole tranches of Dorset County Council area were going to be taken out of safe reach of hospital care by these plans. And we also, Dorset County Council area, are losing 4 of the 5 community hospitals that are being closed. And nearly all the acute beds are going from Poole and Dorset County. Bournemouth will get more beds, but actually around 500 beds will be lost from Poole and Dorset County. So it's all about the Dorset County Council area. It's clear it's not going to be good for their residents. And yet it took us 6 health scrutiny committees of each time fighting to get it referred over a period of more than a year. But we have now done that. We've got Dorset County Council to refer it. And we also lobbied Poole Borough Council, who, it's their hospital, had dragged their feet for so long, and they finally sent a letter in this January in support of Dorset County Council's referral. I cannot tell you how much easier it would have been to get the local authorities to refer it if there had been Labour members on those local authorities. We had 1 Labour member on the county council, but not on health scrutiny, so we had no Labour members on health scrutiny. We have 1 Labour member on the town council. We've got no Labour members on the district council. We've had to fight and fight because really we're asking the Conservative councils to object to their own government's cuts. That's why our local A&E and maternity are being closed. That's why our community hospitals are being closed. That's why our acute beds are being closed. They're being closed because central government have cut the money for the NHS. What they've done is each year they've increased the budget, but where the annual increase used to be 4%, it's been only 1.2% for 8 years. This means the NHS funding has been squeezed like it's never been squeezed before, and all the trusts have been pushed into deficit, where in order to balance their books, they're going to have to cut their services. There's no need for this to be happening. We can afford the NHS. We're the 5th biggest economy, but we're 17th in terms of the amount we spend per head on healthcare. No one voted for the NHS to be defunded. They didn't vote for the staff not to get a pay rise for 8 years. They didn't vote for the nurse bursaries to go or the tuition fees to be introduced. And these things have all had a huge impact on our NHS. The services are struggling because the money's not been there, and the staff have felt under attack, and staff are not being encouraged to come in. So a big staffing crisis is being created. It's essential that we get people in who really care about the NHS. Labour founded the NHS. Labour have pledged to reinstate a publicly provided NHS. And just a couple of weeks ago, we've had no interest from any Dorset Conservative MPs on this matter. But just a couple of weeks ago, Labour's Shadow Secretary of State for Health, Jonathan Ashworth, came down here and talked to us about the loss of Poole A&E and maternity. And he pledged that if Labour were in power, they would halt the plans to close it. And I will do what I can to try and ensure that on a national level, we get a government in who isn't running down our NHS and trying to sell it off and privatise it. So I hope I've conveyed to you how much I care about the NHS and how hard I've worked. We've had local media with us along the way, Radio Solent. We've had South Today with us along the way. Radio Solent came with us to the court hearing in London. And I'd like to thank local radio and television for accurately reporting the facts of the case. They've reported about the risk to residents. Anyway, thank you for your time, and I hope that you will consider voting for me for both the Unitary Authority to stand up for Swanage and for the Town Council. Thank you.